Hi, my name is Amelia and I'm doing my presentation on STIs. So today we are going to be looking at what is an STI, how do they enter the body, the effects the infection has on the body, what STIs are curable, what STIs are lifelong, how some of these STIs are treated, impacts on pregnancy, and some statistics surrounding STIs. So what is an STI? STIs are infections which are spread through sexual contact. They can be caused by bacteria, viruses, or parasites. They can have adverse effects on fertility and other aspects of physical health. For example, it can lead to causing cancer. One of the ways these can be contracted, some of the ways these can be contracted is shown on the image on the screen. So this could be through oral, vaginal, or anal intercourse. Upon contraction of an STI, symptoms may take different lengths of time to show. For example, chlamydia may take around 1 to 2 weeks, while hepatitis and syphilis can take 12 weeks before presenting symptoms. So the effects that the infection has on the body. The pathogens will invade the host cells. Once the infection multiplies, it will spread, causing further symptoms and weakening the immune system. Varying from person to the infection, symptoms will vary. For example, a woman may exhibit green coloured discharge with trichomoniasis, whereas some people will remain asymptomatic, meaning they won't have any symptoms. STIs can also make the host feel physically unwell, sometimes presenting with flu-like symptoms. It can damage the host's reproductive organs. This will leave the host infertile. These are just some of the effects that STIs can have on a person's body. What STIs are curable? Infections like chlamydia, gonorrhea, and syphilis can be treated with antibiotics. The image on screen is an example of the swab used to test for these STIs. So a swab will be taken and you would do a swab of the suspected infected area, such as the vagina. These will then be sent off for testing. Once the person has been diagnosed with the ST, they can then be effectively treated with the antibiotics. STIs that do not have a cure, such as HIV, herpes, and HPV, even though they do not have a cure, they can be managed very well due to medical advances. These are viral infections. HPV doesn't have a treatment. It can sometimes clear itself up. In other cases, it can advance to cancer, cervical cancer. Although HPV does not have a cure, it does have a vaccine which is given to children in secondary school. It was only given to girls until 2019. However, further studies have shown that men are the main carriers of HPV, so are now being vaccinated as well. For more easily treatable infections such as chlamydia and gonorrhea, they will be given a course of antibiotics. Chlamydia, you will take the antibiotics for around a week, whereas gonorrhea is treated with one single dose or shot of antibiotics. Whereas HIV, even though it doesn't have a treatment as such, it does have medication. This is an antiretroviral therapy, also known as ART. If a person manages that ART, they will eventually have an undetectable viral load. This means that if they was to have unprotected sexual intercourse with someone, that person isn't at risk of catching HIV. Over the last few decades there has been lots of advances with HIV medication. In the 1980s, the UK did declare a HIV epidemic. Since then, there has been lots of advances made with the medication. Around 1990, people was having to take lots of medications multiple times a day. They then managed to change it to just one pill around 2007, and in 2020 it was changed to just a single dose every month. This obviously makes it a lot more effective for people managing HIV. And then there is herpes. This is one of the most common STIs, with around 70% of the UK having RSV1 and 10% having RSV2. This is genital herpes. RSV1 is like cold sores around your mouth. Although there is no treatment, there is alkalavir, which helps manage symptoms when a person is presenting with a flare-up of their herpes. Having an STI while pregnant can cause risk to not only the person but also to the unborn baby. This is why midwives will carry out regular STI tests throughout pregnancy. If a person was to give birth while infected, this could cause the newborn to catch the infection, as shown in the image below. This baby was born with chlamydia in their eye. In this particular case, the baby was treated, whereas in some cases this could transmit to the baby being born blind, premature, or in worst case be stillborn. However, so that's the worst case with pregnancy. It could also affect the ability, someone's ability to be able to become pregnant. Having an untreated STI can cause infertility, making it impossible for an individual to be able to become pregnant. Some statistic around STIs. So it is proven that females are more likely to have an STI due to biological factors such as anatomy. This is because the female reproductive system, everything is a lot more closely together, allowing the bacteria to spread more freely and easily. 15 to 24-year-olds are the age range which has the highest rate. This is due to an increased likelihood of new sexual partners. According to some studies, it is shown that people who are of Black Caribbean ethnicity are the most at risk from STIs. The reason to this is actually unknown and requires more research. And the most diagnosed STI in the UK is chlamydia. In 2024, there was 168,889 cases confirmed of chlamydia in the UK, as shown on the image. So, in conclusion, sexually transmitted infections remain a significant public health concern, with certain groups being more affected. Statistics show that targeted education and awareness may be needed for more specific populations such as Black females aged 15 to 24 to improve understanding and testing and the increase of engagement with sexual health services. This highlights the importance of exploring reasons behind lower testing rates, including potential barriers and access, awareness and stigma. Advancements in treatments have also significantly improved outcomes for individuals with STIs, particularly in relation to HIV. Over the past few decades, treatment has progressed from limited and ineffective to highly advanced medications. This allows individuals to live long and healthy lives. long and healthy lives. This demonstrates the importance of continued research and development in improving management and infections and reducing their long-term impact on the individuals and the public health. Thank you. Any questions?